Parkinson's disease, as you may already know, is an incurable disease, but as modern medicine advances, there is hope for a better tomorrow.
April is Parkinson's Disease Awareness Month, and to help educate us about the disease is Dr. Ryan Kochanski, a neurosurgeon with Methodist Hospital. Good morning.
Morning.
Good morning, doctor. So let's kind of do a brief overview, if you will. What is Parkinson's, and what are some of the common or maybe uncommon signs and symptoms associated with it?
Yeah, so Parkinson's disease is one of the most common neurodegenerative disorders. And so what that means is the disease is caused by a loss of a special neurotransmitter deep in the brain called dopamine. Dopamine is very important in running the neurocircuitry of the brain that is involved with coordinated and smooth movements. So when dopamine's lost, the cells aren't able to fire in a coordinated fashion. So think about a symphony that's lost its composer. And so everything is running out of sync. And so what does that lead to? That leads to the three main symptoms of the disease, which are movement related. Those are tremor or shakiness, which happens while the patient is at rest, slowness, or what we call bradykinesia, where the movement is very slow, or rigidity, where there's stiffness as well. And patients can be affected in different ways, whereby, say, tremor affects one patient more than, say, rigidity, versus another patient is affected more by rigidity than tremor. And so those are the common symptoms, and that's their cause.
And we were talking earlier how the disease is not curable, but how is Parkinson's disease treated? Yeah,
so medications have been around for a while, and they're very effective at treating early stage disease. But what happens is, over time, the medication becomes less predictable to dose, meaning that it's harder for patients to get symptom relief when they're taking the medication at the same frequency that they had been before. And so a good option in those situations is something called deep brain stimulation, where we implant special wires deep within the brain in structures that are involved in the circuitry of movement. And we turn those wires on, and that leads to improvement of those main motor symptoms that I talked about. So think about adding the composer back into that symphony, and then that symphony is able to, play in a coordinated fashion. And so movements are able to improve and smooth out, and we worry less about the medication dosing.
Dr. Kochanski, who is a candidate for this deep brain stimulation?
It's a good question. So folks where they've responded initially very well to medication, but then that medication is becoming less predictable to dose, or it's becoming less effective. We know that those patients are generally very good candidates. This disease really affects quality of life. Some of my patients, are avid tennis players or golfers or skiers. And so, our goal is to be able to restore their ability to participate in the activities that they love to do every day. And so, deep brain stimulation is an excellent therapy for those patients.
And how many of these surgeries are performed at Methodist a year, for instance?
Roughly.
Yeah, so we can do as many as 40 to 50 per year at Methodist. And what's great about at Methodist is we have special technology to do this procedure very safely under general anesthesia. Historically, this is a procedure where the patient is awake, and we require the patient to be awake because we need to monitor brain activity and make sure we're not stimulating parts of the brain that we don't want to stimulate. But this unique technology at Methodist provides us with an MRI scanner that comes into the operating room. And that allows us to confirm right then and there that we're not close to areas that we don't want to be near, and that we're in a safe location. So it's a much better experience for the patient. It's a much more comfortable experience for the patient because they just go to sleep. They don't have to participate, and let us do all the work. And this is a very safe and accurate method to do this surgery effectively. So I'm really happy that we have this technology. and such a great team to use it at Methodist Hospital.
We agree 100%. All right, Dr. Ryan Kochanski, a neurosurgeon with Methodist Hospital here in San Antonio. Thank you so much for joining us, Ryan.
Thank you very much for having me.
Take care.